Good to have you back on the show, Doctor. And I'm just going to ask you questions that I think people want to know, because I want to know about public transportation, for example. If you need to go to work, you use public transportation, a bus or a subway, you wipe your seat down, you wipe your hands, you wear a mask. Are you safe?
Yes, of course, these are all ways that individuals can protect themselves. I think people need to understand that enclosed spaces that are enclosed inside, carry a greater risk of transmission than spaces that are outdoor, have fresh air moving through them. So, of course, you can protect yourself by wearing a mask. You can protect yourself by wiping down your seat. And, of course, using hand sanitizer or washing your hands after you get off the bus, if possible. Those are all ways that you can protect yourself on the commute.
And isn't the issue keeping your hands clean? And is there a difference between using hand sanitizer as opposed to like a bleach wipe, which I would think would be stronger? But how much does that matter?
Right. So, I mean, I think it's really important to note that you can simply wash your hands with warm water and soap, as has been said before, for 20 seconds, and that will be just as effective as using hand sanitizer. Usually, we would recommend using those bleach wipes on surfaces as opposed to hands. But obviously, they do a similar thing of killing bacteria, viruses. In this case, it's a virus, so that's what we would hope that it would kill. But of course, the other thing that's really important is also about how you handle the mask. So that's something that people need to consider as well. It's really important to remember that you should only put the mask on and off from the ear handles as opposed to touching the front of the mask. And that's something that I'm not sure a lot of people know.
Dr. Abuelazam, it's Willie Geist. Great to have you on this morning. I want to ask you about Georgia and Florida. There were obviously dire predictions and grave concerns when Georgia and Florida began to reopen, allow people into retail outlets, go to beaches and things like that. The worst predictions have not been borne out. What do you read into the cases of those two states that people were watching very closely as they considered how to reopen their own states?
Sure. I mean, I think it's really important to remember that the death count will always lag behind the number of new infections. So when we're thinking about how we're going to measure how effective or ineffective a lockdown was, or how effective or ineffective opening up is, there's always going to be that 2-week lag to the infection numbers, and then a further lag to the death numbers. And so one possibility is that we're not actually at the point yet of seeing the effects of reopening in these contexts. I think another thing to consider is whether or not people are actually using the protective measures that we've been suggesting. So are people, when they are going to stores or the mall, are they wearing masks? Are they making sure to wash their hands? There are ways to protect yourself even as we open up. But I think the important thing also to note is, are we testing enough? Are we actually do we actually know how many new cases have occurred in these contexts? Without a sufficient testing program in each of these states, we actually may not even know whether or not there's an increase in the burden of coronavirus after opening up. So there are a number of different pieces that would go into my interpretation of how severe the cases are after opening up.